Hi and welcome. I'm trying to learn medicine, today cervical cancer, and after we've done it, we're going to do shoulder impingement training. And if you participate in the shoulder impingement training, then it's at your own risk. And we're talking about internal anatomy and diseases, cancer, and this is no medical advice, we're just learning about it. Cervical cancer, that is a malignant growth in the neck of the uterus, the womb. This is relatively rare, but where it used to affect mainly women over 35, it is now occurring in younger women. This book is from the 80s. The cause of this is uncertain. Increased use of contraceptive pill may play a part. But okay, this book is from the 80s, so maybe we're so vague about it. Okay, cervical cancer, that is a malignant cancerous growth in the neck of the uterus. Symptoms. Okay, we're also talking now about more medical aspects, blood and so on. Symptoms: bleeding between the periods, bleeding after sexual intercourse, bleeding after the menopause, unexpected vaginal discharge which may be brown and offensive smell. Okay, bleeding when it should not be, so a part of the periods and also after the menopause cannot happen. And smelling of a vaginal discharge which is offensive and maybe brown. Duration: until the condition is treated. Does it last? Causes: the risk of cervical cancer is increased by promiscuity, particularly if sexual activity is we're talking so also about these things now. Particularly if sexual activity is unprotected by condom or strap. Okay, we're saying intercourse with multiple partners, unprotected, is a risk factor. Intercourse before the age of 18 is also associated with a greater risk, and again, this book is from the 80s. Intercourse before the age of 18 is also associated with a greater risk. Complications: cancer may spread from the cervix to other organs. Treatment in the home, none is possible. When to consult a doctor? Immediately there's any unexpected bleeding or discharge from the vagina, either before or after the menopause. So if there's bleeding, which should not be at the time. What a doctor might do: carry out an internal vaginal examination and take a cervical smear. Okay, a probe and examination. Arrange an examination by a gynecologist who will examine the cervix. He or she may then be able to destroy abnormal cells by laser or freezing. Again, this book is from the 80s, but still, for laser and freezing. Okay. In advanced cases, hysterectomy or radiotherapy will be necessary. Prevention by radiotherapy, but it's radiotherapy. Prevention: regular smear tests every 3 years. That is enough. That is interesting. And it can be treated oftentimes through laser and freezing. And every 3 years, just a test. So regular smear tests every 3 years, especially for those taking contraceptive pills. Outlook: before cancer develops, cells in the cervix are in the precancerous state, which can last for up to 10 years. Let's read that again. Before cancer develops, cells in the cervix are in a precancerous state, which can last for up to 10 years. No questions aside, are there other types of cancer where years earlier the cells are in a precancerous state? These cells can be detected with a cervical smear test, and if treated at this stage, the prospect is very good. Once cancer has developed sufficiently to cause symptoms, the chances of complete cure are reduced, hence the importance of regular cervical smear tests. Okay, cervical cancer, that is cancer of the neck of the uterus. If it is detected, so we're advising to make a test every 3 years, before it has really developed, and it has developed with the symptoms of bleeding which shouldn't be at the time, and also maybe brown discharge and offensive smelling of a discharge, then the treatment should be quite good. If not, it is worse. Okay. That was somebody. If you were here for medicine, you can go directly to the next part of medicine. If you are here for shoulder impingement training, you can stay and participate. But if you do so, then it's better your own risk. Good in 7 cents, and we're doing shoulder circles. We're going back, up, and front, and down. And no backwards. And last time. And now long arms with strong fists, and go as far back as you can with the shoulders. High up and in front, and down, again back, up, and front, and down, and now backwards. Up, and back, down, front, up, back, and down. Now we accelerating motorcyclists. Go a bit into the knees, legs wide apart, hinge forward with a straight back, let the arms hang, and pinch the scapulars together with the pedal. Big fists, lift the arms up and pinch the scapulars still together. Lift the arms down, and shoulders, and another turn. And now big fists, and lift the arms up and pinch the shoulders together. The arms up. And next exercise, the sheet jumper. A bit into the knees, hinge forward, fist and with around with, lift the arms hang, make fists. Turn your fists to the inside, lift the arms high up and bring them together. Straighten up, bring the shoulders down and together. Arms high up and together, shoulders down and together. And release. And the second time. Into the knees, hinge forward, with the round back, the arms hang, like this. Arms to the inside, arms are up and together. Straighten up, bring the shoulders down, together. Release. And now, just lift the arms up. If this exercise causes pain, then don't do it. Just to loosen a bit. And also to observe if a shoulder impingement happens when the arms are lifted. And now the arms to the side and together. Observe what the scapulars are doing. We go now together and a bit to the outsides of the ribcage. Together. Next exercise for the left arm. Go to 7 cents. Shoulders bit back, tall up. Long arms, strong fists. Bring the shoulders down and together. Now turn the arms to the inside with the effort. So arms to the inside, shoulders down, together. Arms to the outside, shoulders down. And arms to the inside, shoulders down, together. Arms to the outside, shoulders down, together. And to the next exercise. Arms to the outside, a bit in front, turn the arms in front, shoulders down, hands together. And arms back, shoulders up and in front. Arms in front, shoulders down, hands together. Arms back, shoulders up, front. And do the next exercise. The shrug. You lift the arms up. And shrug the shoulders up. And release all down. Again, in the arms up. And down. Like that. Breathing is necessary. Just the arms up. Shoulders up. And down. Now the Cervical, arms together, and it down into the outside, and back. And then also last time. And now with some diet. You can also use a tennis ball. Everything with a long arm at the outside. Let it fall down. And try to catch it again. And on the outside. And now the stretching. One arm in front, the shoulder is back and down. Pull the arm in, have flat fingers, try to relax the arm. Go with the back of the shoulder, turn the palm up to the sky. The other arm in front, shoulder is back and down. Pull the arm in, have flat fingers, try to relax the arm. Go with back of the shoulder, turn the palm up to the sky. And that was the stretching. So it was the whole shoulder pinch training. I thank you very much and until next time.